So I've been here about 7 years. My first 3 years here, I did exactly what I wanted to do, which was bread and butter gastroenterology. And then for about 3 years, I served as the Vice President of Medical Affairs for the medical group. And then starting in August of 2018, I became the Health Systems Chief Medical Officer. So when I came here about 7 years ago, if I remember correctly, there was actually one full-time physician in leadership, and that was Dr. Medley. And under Greg Strahan's stewardship, the CEO, we really have expanded that to now I'm the second chief medical officer for the system. There was the vice president of medical affairs for the medical group. We have a chief medical information officer, a chief quality and safety officer, all physicians. And now the physicians we bring in are not only focused on medical leadership, but they're still involved in patient care. So it's with that leadership that we're able to help the organization to really move to where we think it should be. If you can always keep that in your mind, that the patient comes first in everything, then you're going to do great at this organization. So I came from Philadelphia in a health system that's 200 years old. It's a great facility, but doesn't compare to this at all. This is a state-of-the-art organization. The hospital is 6 years old. The equipment is second to none. We bring in physicians for recruiting, and we take them through the ORs, and they come out and they're like, I've never seen anything like you have here. One of the things that brought me here was in my recruiting process, I got to meet a lot of people, and I was really pleased at how accepting the whole community is. And it has really lived up to that since the day I got here. This is a really family-oriented, kids-oriented community that I would compare to anywhere. We now are, in essence, responsible for the healthcare of a 14-county community. We are reaching out into the community. We've recently hired a physician who's now the Vice President of Population Health, and it's his role to really determine the needs of the community and how we can come out of the hospital and come out of our offices and reach out into the community and help people to achieve a better lifestyle, a better health style. We're really focused on tobacco cessation and exercise and cardiac health and food and nutrition. And it's a really exciting time in medicine in general. It's changing so much, but particularly here in Owensboro.